Good evening, everybody, and welcome to the library tonight. I'm Michael Bellicosa, the head of adult programming at the library, which means I get to work with lots of partners in our community to put together all kinds of programs on all kinds of topics and themes, and we have a lot of fun with it. This is an annual program that we've been doing for years, right before the open enrollment period. Very popular, tons of information. You'll also be able to get a copy of this PowerPoint. I will email it to you, along with, as long as the technology cooperates, a link to a recording of this also. So just so we can get started, because we have a lot to cover, I would just like to thank our friends and collaborators at the Wilton Department of Social Services and also the Southwest Connecticut Agency on Aging. And you will hear from Lauren Hughes from Wilton Social Services towards the end of the program. And right now, I would like to introduce Lisa Alhabal and Jocelyn Toomer, who are going to tag team the presentation. They're from the Southwest Connecticut Agency on Aging.
Hello, good evening, everyone. My name is Jocelyn. I'm from the Southwestern Connecticut Agency on Aging, also known as SWCAA. We're located at 1000 Lafayette Boulevard in Bridgeport, and I am the newest member of the Choices team, so this is my first presentation. There are 5 area agencies on aging in Connecticut. You can call the 1-800 number, and they can direct you to your local office on aging. Choices is the state health insurance program for Connecticut. So in the back of your Medicare and U book, you can call your SHIP for Medicare counseling. So we're about to begin the presentation. So what is Medicare and who is eligible? Health insurance for people 65 and older, under 65 with certain disabilities, any age with end-stage renal disease. To get Medicare, you must be a U.S. citizen or lawfully present in the U.S. and must reside in the U.S. for 5 continuous years. Enrollment, initial enrollment period. So the initial enrollment period, 7-month period, starts 3 months before the month you turn 65. The month you turn 65, 3 months after the month you turn 65, the coverage begins. And for example, if you sign up in January, it'll start the following month, which will be February. Okay. Automatic enrollment. So those collecting a Social Security benefit will automatically be enrolled in the Medicare Parts A and B. Initial enrollment package will be mailed 3 months before eligibility. When to take action. Those who are not collecting a Social Security monthly benefit must enroll in Medicare Part A and B. You can visit www.ssa.gov, or you can make an appointment with your local Social Security office or call the Social Security at 1-800-772-1213. Ask yourself, do I need to enroll in Medicare? Am I covered under any employer group health plan? Who might delay enrolling? So employer group health plan coverage based on active, you or your spouse, employment. Must be 20 or more employees. If disabled, must be more than 100 employees to defer enrolling in Part B. Enrolling in Part B. Once you or your spouse decide to stop working, you will be granted a special enrollment period. Special enrollment period. When is my special enrollment period? While you have coverage from an employer, or the 8 months after your coverage ends for Parts A and B, the 63 days after your coverage ends for Part C and D,
When you first go on to Medicare, you will receive a Medicare and You book for the year following. So once you're enrolled into Medicare, you will get a Medicare and You book, like, and this is the one for 2023. Okay, Medicare also has preventative services. There's a whole list of preventative benefits that is in your Medicare and You book. We always encourage people to please look at their Medicare and You book. Most Medicare beneficiaries, when they get their Medicare and You book and they call choices and they say, I want to know what's covered under Medicare Part B, is thus and such covered. And we say, did you look in your Medicare and You book? And they say, what? The red, white, and blue book that said Medicare and You? Oh, I threw that in the garbage. I just didn't want the extra paper. But we definitely need you to look at your Medicare and You book because there's a wealth of information in it, including all the preventative benefits. Okay, under original Medicare, you normally pay nothing for preventative benefits, with the exception, sometimes you will pay for colonoscopy. Oops. If in fact you have a colonoscopy and polyps are found, then you would be charged, and it would be outpatient surgical procedure where you would pay the 20% copay. Medicare pays 80%, and the 20% you would be responsible for. Okay, under original Medicare versus a Medicare Advantage plan, these are your options when you're looking at what coverage you want under Medicare. Medicare Part A is for hospitalization. Medicare Part B is for doctor visits, specialist blood work, and things of that sort. Then you have Medicare Part D for prescription drug coverage. And then you have the option to get a supplemental plan that pays the co-pays and deductibles that you would be faced with if in fact you didn't have any other insurance. Or you have the option to go into a Medicare Advantage plan. They also call it Part C. I know you see all the commercials now. Everybody's trying to get somebody into a Medicare Advantage plan. But it combines your Medicare Part A, B, and D. So you have to have A and B to join a Medicare Part C plan. And if you want prescription drug coverage, you have to pick a Medicare Advantage plan that includes drug coverage, because if you pick a plan that does not have drug coverage, you will not be able to purchase a separate PDP. You wouldn't be able to purchase a separate Medicare Part D plan. Okay, Part A costs for Medicare Part A for hospitalization. If you've worked 40 quarters or 10 years in your lifetime, it's a zero premium. For persons at 30 to 39 credits or 0 to 30 credits, the numbers are there. The deductible for Medicare Part A in 2022 was $1,556. In 2023, it's going to be $1,600. Okay, for hospitalization, for days 1 through 60 is free. For days 61 through 90, it's $400 for 2023. $800 for days 91 through 150. For a skilled nursing facility stay, days 1 through 20 are free. Days 21 through 100 is $200. Okay, the Medicare Part B costs for 2022 is $170.10. It's going down, which everyone should clap, because this is actually a miracle. I've been doing this for 17 years, and I've never seen the Medicare Part B go down when someone's getting an 8.7% increase. Normally, when the Social Security Administration gives you an increase in your Social Security, your Medicare Part B normally goes up, and it normally eats the amount that you normally get. So this is one miracle this year. So it's gone down to $164.90. The deductible for Medicare Part B also went down from $233 to $226. I'm not gonna read all of this information, based on your yearly income. If you make more money, you pay additional funds for your Medicare. And, this is for informational purposes, so, if you are over $403,000 a year, you're gonna pay $560. So you can actually look at that. The Social Security Administration actually looks at your taxes, and they actually calculate this, and they will send you documentation in writing if you are of a higher income. Yes.
Which year do they base that on?
They normally base it based on 2 years, the previous years.
And every year they adjust it, they look at your.
Right, they adjust it based on your current income, because like some people have businesses and things of that sort, and they have a higher income, or they have, a job where they're making, 6 figures, but once they retire, they're not making that anymore, so they look at the current after that, and they adjust it accordingly,
And as you go on, they, every year they adjust it, they go.
based on your income, right?
Or when you retire, that is what sets it up, but they don't change it.
No, they change it based on your income. If your income is lower and it goes under $97,000, you would be, under the normal amount that everybody else would pay.
And is that the adjusted gross income or what's the?
It's based on your income tax. I'm not a tax person. I'm not the IRS, and I don't want to give you something that, I'd rather say, that's a good question, let me research it and get back to you, than try to answer something that I'm not sure of. I'm not sure whether it's gross, or not. But the Social Security Administration calculates all of that for you. Excuse me. Are you supposed to start here? You want me to take this and?
Yeah. She has a question.
Oh.
Is there an out-of-pocket maximum, or does that depend on what supplement you're buying?
Out-of-pocket maximum for what?
For your copay?
Out-of-pocket maximum,
Every year, let's say. Is there a maximum?
under a Medicare Advantage plan, there's a maximum out-of-pocket of $6,700, but there's no maximum if you're just on original Medicare A and B. Or you mean the premium?
No, I mean
Your 20% copay.
your 20% copay.
No, there's no out-of-pocket maximum.
So it can just keep going, or is there a cap on that?
No, it depends on the services that you have done.
Okay,
You know
so
what I
it
mean?
depends on
So,
the extra.
right, so you pay 20% copay. Like, let's say you go to a doctor, you go to a dermatologist. The dermatologist charges $750 for the visit. When Medicare looks at it, they're gonna look at the usual and customary amount. That amount may be $250. So it would be adjusted based on the usual and customary amount. And then you would pay 20% of the usual and customary amount, but there's no limit to that.
So if you have some weird thing that costs you $200,000, you could be paying $40,000.
Right, but if $200,000, yes, go ahead.
Hi, I'm Laura Hughes from Social Services. Almost everybody who chooses to stay on original Medicare purchases a supplemental plan. And once you purchase a supplemental plan, the supplemental plan takes care of all of that 20%. So the reason there's no maximum is because nobody's paying that 20%. You're paying a monthly premium of approximately $200 maximum for the most expensive plan, if that makes any sense. And so $2,400 is this plus, what is it for next year, $226 for the Part B premium is essentially your out-of-pocket expense. And the supplemental plan takes care of everything else. It takes care of the 20% of that $200,000 service.
Right, that's if in fact you decide to purchase a supplemental plan. But if you don't have a supplemental plan, you will pay 20% of the total cost, and you would pay the deductible for hospitalization.
Okay. So Medicare Advantage, also known as Part C. Medicare Advantage is a Medicare-approved plan from a private company that offers an alternative to original Medicare for your health and drug coverage. These bundle plans include Part A, Part B, and usually Part D. In most cases, you'll need to use doctors who are in the plan network. Plans may have lower out-of-pocket costs than original Medicare. Plans may offer some extra benefits that original Medicare doesn't cover, like vision, hearing, and dental services. Part A, Part B, most plans include Part D, some extra benefits. Some plans also include lower out-of-pocket cost. Extra benefits: dental, vision, hearing, gym memberships, over-the-counter, food cards, Part B premium, givebacks, telehealth, also visitor travel, personnel emergency response, cash cards. Some plans require an additional premium for these benefits.
Okay, there's all types of, there's 3 different types of Medicare Advantage plans. And I just want to say, when you join a Medicare Advantage plan, you're signing over the management of your Medicare benefits to a private insurance company to manage instead of Medicare. So all your claims go to that private insurance company. They make decisions on the claims. So if in fact they deny a claim, you have to go through their process. Some people think that because they have to have A and B in order to get into a Medicare Advantage plan, if the Medicare Advantage plan denies it, they can just go to Medicare and submit the bill to Medicare. That's not the case. It would go directly to the plan of your choice, that private insurance company. But there are several types of Medicare Advantage plans that are sold in Connecticut. There's HMOs, which are, most people know about, health maintenance organizations, where you have to go to doctors within their network. Okay, then there's preferred provider organizations, which give you the option to go out of network but at a higher cost. So in your Medicare and U book, you might see that it's a PPO and it says, $15 for, well, really $40 for a specialist, out of network $50 or $60. So it's higher if you go to a physician out of network. Then there's special needs plans. Those plans are the DSNAP plans. You have to be enrolled in Medicare and Medicaid or the Medicare Savings Program, QMB, in order to join them. There's also CSNPs. Those have specific chronic disabling conditions like end-stage renal disease. And then there's I-SNPs for people that live in institutions. Do you have that thing? Okay, currently there's 29 Medicare Advantage plans in our area for 2023. There's 16 special needs plans. Aetna has 7, Anthem Blue Cross Blue Shield has 9, Connecticut has 10, United Healthcare has 11, and WellCare has 8. Okay, there's plans that also have, do not have Medicare Part D drug coverage within them. The United Healthcare Medicare Advantage Patriot Plan, the Aetna Medicare Eagle Plan, and the Connecticut Choice Plan 2. The only time that a person that, these plans are for a person that has drug coverage through another means, like if they're a veteran, or if they have TRICARE or something like that, that's when a person would choose a Medicare Advantage plan without prescription drug coverage. Because like I said, if you join one of these plans and then you still need prescription drug coverage, you're not able to purchase a separate Medicare Part D plan. Okay, different changes for 2023. The Aetna plans remain the same. Anthem Blue Cross and Blue Shield dropped in star rating from 4.5 to 3 stars. I know people are very into, the star system with their Medicare Advantage plans, so we wanted to put that in there. The Medicare and U book has errors in it. For the Cigna Preferred Plan, Medicare HMO, The coverage area is listed as being offered statewide, but it's only available in New Haven County. Because when you look for a Medicare Advantage plan in the back of the book, it will say what county it covers. It'll either say all the state of Connecticut, or it'll say Litchfield County, Hartford, New Haven. But it says that it's statewide, but it's only New Haven County, so people are calling, gonna be calling to try to join those plans just to find that they're not offered in our area. The Connecticut Medicare and U book also has an error on Cigna H7849 for the coverage areas. They're listed as being offered statewide, and they're offered in Litchfield, Middlesex, and New Haven counties. There's a new Cigna MAPD plan for 2023. It's called Cigna True Choice Savings, and it has a 0 premium. The Connecticut Part B Saver plan is gone for 2023. Oh, that's you.
Okay. So, questions to ask when selecting a Medicare Advantage plan. So these are some of the questions. Same questions you should ask for the drug plan. Are your doctors, hospitals in network? Do I need referrals to see specialists? Do I need prior authorization for services? How do your total plan costs compare other than medical coverage options?
That was fast. I thought I was going to sit down for 2 minutes. Okay, Medicare Part D prescription drug plans. This is for prescription drugs. There's 24 standalone prescription drug plans to choose from. They range from $6.80 to $126.60. The drug deductible maximum is $505 for 2023. There's 6 benchmark plans. Those are for people that have Medicaid or are on the Medicare Savings Program. And there's 3 new Medicare Part D plans. This is just an explanation. I'm not going to go through this whole thing. This is just an explanation that you can read at your leisure. It just gives an example of how the Medicare Part D plans go. Once a person goes through their deductible, if in fact they have a deductible, they pay that amount. Then they pay the copay, and the plan pays until you get to $4,660. Then you pay 25% for generic and name brand medications until you get to $7,400. Once you get to $7,400, you pay 5%, or you pay the what they call the low income subsidy copays, which are generics $4.15. For generics, name brand medications are $10.35. So it's either that or 5%, whichever is higher. Once you get to what's called catastrophic coverage. So it's after $7,400. Change my slide. Okay. Changes for Part D plans due to the Inflation Reduction Act of 2022. They're trying to reduce the cost of drugs tied to inflation, and the drug companies are going to be required to pay rebates to Medicare if retail drug prices rise faster than inflation. So right now, starting January 1st, there's no copays for vaccines. Medicare Part D beneficiaries won't have a cost sharing for vaccines that are recommended by the Advisory Committee on Immunization Practices, such as shingles. I believe the COVID is still free. Someone with Medicare who takes insulin covered by their prescription Part D plan, they'll have a $35 copay. That will be the maximum amount that they would pay. And that person also would not be affected by the deductible for insulin only. So if a person has a $505 deductible, if they have an insulin, that insulin would still be $35 during the deductible phase, which is very important, and that starts January 1st, 2023. So if anyone does a plan comparison for you under Medicare Part D, what happened with the Center for Medicare and Medicaid Services, the Medicare Part D plans had to submit the pricing to go into the Medicare.gov website by June 1st. This wasn't approved, the Inflation Act wasn't approved until August. So in the plan finder, the actual numbers are incorrect. So if you put in an insulin, it may say that insulin is still $300 a month. But it's in actuality, it is actually $35 a month. So what they're suggesting is that when a person does a plan comparison, that they put the insulin into the Medicare plan finder to make sure that it is in the formulary of the plan before they join it, but then take the insulin out of the formulary. So you have to put the medication in, find out if it's on the formulary, take the medication out, and then compare and see if all of your drugs, and it will give you an annual cost. Then for every insulin, you add $420. So if you take 2 insulins, you would take $420, that's $840, times 2, and add that to the total cost of drugs for the entire year to get your actual costs for the year. Confusing? Yes. Everything in Medicare is confusing? Yes. So, we also have choices counselors throughout Southwestern Connecticut that help with plan comparisons and things of that sort. And if I was on the other side in the audience listening to this, I would think you were speaking Greek. So, if you need assistance, we're here to help you with things of that sort. So, reach out to the choices counselors, and I believe Wilton has an event, an enrollment event. When is your enrollment event? November 10th, you can sign up to have a one-on-one consultation and have a Medicare Part D plan comparison done for you with seasoned choices counselors that can help you with it. Okay? People that get insulin through a traditional pump covered under Medicare Part B, which is under durable medical equipment. If your insulin goes into a pump and it's pumped through a piece of durable medical equipment, that insulin doesn't go into effect. That rule for the Inflation Reduction Act doesn't go into effect until July of 2023. Okay? These are the benchmark plans that are offered for 2023. These are for people that have the Medicare Savings Program or full low-income subsidy. And these plans are free for those people that do have the LIS, Medicaid, or the Medicare Savings Program. The benchmark premium is $36.27. So if a person that has the Medicare Savings Program or LIS chooses not to have a benchmark plan, when they go into another plan, it would be reduced by $36.27. You want to?
Okay, so questions to ask when selecting a drug plan. Are my drugs covered? Are my covered drugs under a different tier? Do any of my drugs have restrictions? Is my pharmacy of choice in network, or is it a preferred pharmacy? Will I enter the coverage gap?
Go back one slide. I just wanted to say, as far as restrictions, the restrictions under Medicare Part D are very important when you're doing a plan comparison. What you want to look for is the least amount of quantity limits, step therapy, or prior authorization. Quantity limits, for example, if, let's say, the doctor prescribes you to take the medication twice a day, so you need 60 pills a month. If the plan is only willing to pay for 30 pills, that means the other 30 pills are on you. So if it has quantity limits, that may not be the plan for you. Under step therapy, normally the Medicare Part D plan has a list of medications that the doctor has to try before they're willing to pay for that particular medication. So, that's another one to try to avoid if possible. And the other is prior authorization. Prior authorization means that you can't even get the medication until your doctor sends in a prior authorization and the plan authorizes approves the medication to pay for it. So those are very important, the restrictions on Medicare Part D. Okay, now we're on supplemental plans. Those were what Lauren Hughes was talking about, also known as Medigap. Because Medicare Part A, like you saw the deductible for Medicare Part A, you saw the 20% copay for Medicare Part B, the deductible for Medicare Part B. Medicare does not pay for everything. So people do have the option to have original Medicare, get Medicare Part D, and get a supplemental plan. So that's something to consider. The plans range in premium and coverage, big comparison. Plans are standardized, meaning, I'll show you what I mean, as far as standardized plans. They're community rated, so in other states, they're rated by age, by health conditions and things of that sort. In Connecticut, that's not the case. And there's a continuous enrollment period, so you can join a supplemental plan anytime during the year. So if you decide, like in January, you get a Part D plan and you have A and B, and you say, I don't even want a supplemental plan, I don't want to deal with that now. And let's say February you want to join one, you do have the option to join one.
Have a question.
Yes.
Is there a risk that you have to go to get approval to go from one plan to the other?
No.
I think some states may have.
Yeah, not in Connecticut, you don't have to. Okay, this is the supplemental rate sheet for Connecticut. How do you use the pointer thingy? All right, I'm gonna use the pointer thingy.
Applicable for our area?
Yes, this is for the entire state of Connecticut. This is for Connecticut only, yes.
You want to both left larger copies of this back on the table, people can't read what's here.
Yeah, there's copies back.
Yeah,
Copies back there for over eyes.
yeah, the slide is blurry. It's not blurry, here, but it's blurry
On the
there.
table.
Yeah, does everybody have a supplemental rate sheet? All right, well, I guess I'm not gonna use the thingy. You can't see it anyway. Okay, let me see if I can use the thingy. Okay, what I wanted to show you is that this is a chart that we have in Choices that has all the supplemental plans that are offered in Connecticut. It has the name of the company, the 1-800 number, whether there's a pre-existing condition waiting period, and then it has the pricing for all of the plans. Okay? The second page gives you what coverage is under that plan. So the first thing that you look at is the second page. You look at what type of coverage you want. So if you want, your Part A coinsurance for hospital paid, you would look for any of the plans. Okay, I can't see this myself. If you want the Part B coinsurance, all of them except, with the exception of a Plan K and a Plan L, pays all of the Part B coinsurance. I'm trying to look for skilled nursing facility. If you join an A or a B plan, you would not have coverage for a skilled nursing facility. Your Part A deductible, which is $1,600 for 2023, a Plan A does not cover. So you decide what type of coverage you want, and then you go back to the chart and you choose what letter plan you want, okay? So once you choose the letter plan you want, you look for the most inexpensive plan. Because an example, let me see, I'm gonna use the thingy. Where is it? Oh, look, I can't see it. We're not gonna go by that. Under, let's say, Colonial Penn Life Insurance Company is the third company down. Okay, an A plan is $1,519.42. Do you see that? Okay, and that's for an A plan. Now, when you go all the way down to the bottom, I still can't see it. I think it says $184, $164 under United Healthcare is the cheapest plan. Okay, there's standardized plans in Connecticut. So an A plan is an A plan is an A plan. So a person paying $1,500 is not going to get any more benefit than a person that is paying $180. And people always say, well, why is that? Oh, thank you. I can see clearly now, the blur is gone. Okay, so, yeah, it's $184.25 under United Healthcare. The only reason that plan is higher is because that company sent that amount to the Connecticut Department of Insurance and said, I want to charge $1,500 for an A plan. And the Connecticut Department of Insurance said, okay. And United Healthcare said, I want to charge $184 for an A plan. And the Department of Insurance said, okay. But it's the same exact coverage. So normally when you look for a supplemental plan, let's say you wanted a G plan, which is one of the most comprehensive plans, you wouldn't go to a $630 plan under Colonial Penn. You would go for hopefully maybe a $212 plan, but you're always welcome because we give free non-biased information. You're always welcome to pay $630 if you really want to. People, do not know this because sometimes you may run into a broker that only sells Colonial Penn. So he's going to say, I got the best thing since sliced bread. I got a plan that's going to cover everything. It's only going to cost you $630. And then you're mad when you find out that you could have been paying $212 the whole time. So that's why we give this chart out so that you can look and be an educated Medicare beneficiary. So when someone comes to you like that, you can say, well, why would I do that when I can pick one from, another company that costs way less than what you're charging? Yes, ma'am.
Is there any advantage going to an individual plan company versus a group plan, like United Healthcare?
No, there's standardized plans in Connecticut, so they give the same exact coverage. No matter what company you use, the coverage is exactly the same. And the letter plan, the coverage is exactly the same.
And the cost is per month. It's not a yearly cost.
Right, this is a cost per month, not a yearly cost. Exactly, it's a monthly cost. So
Do you make this decision on an annual basis, or must people?
you can make it anytime you want to. Normally, when a person is new to Medicare and they're coming off an employee health plan, it's best to get a supplemental plan if you're going to get it when you leave your company or you retire and you go on to a supplemental plan, because if you notice, some of them have pre-existing condition waiting periods. But if you've had comprehensive insurance through an employer or other comprehensive insurance, you can get that pre-existing condition waiting period waived. So that's the important thing. And there's also a way to get around that. If, let's say, you didn't get a supplemental plan, a year went by, you didn't have any, you didn't have any comprehensive coverage, you just had A and B and D, and you want to get a supplemental plan and there's a pre-existing condition waiting period. You can go on to a plan that doesn't have a pre-existing condition waiting period, which is going to cost you more if you look at the chart. But you can go on one that doesn't have a pre-existing condition waiting period for the period of time that the plan that you want to go into has a pre-existing condition waiting period. For example, United Healthcare has a 3-month pre-existing condition waiting period. So if you went on to Omaha Life for 3 months and then changed over to United Healthcare, you would have met that 3-month pre-existing condition waiting period by being on another Medicare supplemental plan. So when you went to go on to it, you wouldn't have a pre-existing condition waiting period. That's a way to get a supplemental plan and still have one and still have a condition that you really want to have covered. That's a way to get around it.
At
anytime during the year, and it'll go into effect the beginning of the following month. You just call the plan. Even if you're on, like, let's say you're on Transamerica Life and you're on an A plan and you want to go to a G plan, you just call them and let them know you want to go on to a G plan, and it would go into effect the beginning of the following month. That's what's good about the state of Connecticut, because when you move to other states, it's a different story. They go by age, they go by health conditions, and the premiums are different, and it's, you know, it's really, I think we're one of the best states as far as the supplemental. So that's pretty much your supplemental plans. Just wanted to, yes, sir.
There is that shaded one, it says it is only available for those.
CF and F high deductible?
Yeah.
Yes, your C, your F, and your F high deductible, you would have had to turn 65 before January 2020. If you turn 65 before January 2020, you can still join a C, F, or F high deductible plan. If you're just turning 65 now, you're out of luck.
Do they have any advantage over the other?
I'm sorry, I try to make something fun. I mean, you know, Medicare is not a fun topic, you know what I mean? I try to make a little humor in it. I'm sorry, sir, I cut you off. Yeah. And normally when people go on to Medicare and they call me, they call us at the 1-800 number at Choices, the first thing that they say, I don't care if they're doctor, lawyer, Indian chief. I mean, I got a PhD, so I'm a doctor, so, you know, it doesn't make any difference. And they call and say, I'm confused. I said, guess what? They said, what? I said, if you're confused, you're normal. And you're like, oh, thank you so much for telling me that. I thought it was just me. You know, so people are very confused when it comes to Medicare, so it's just expected. Yes, I'm sorry.
How much are the drug plans?
The drug plans are like I think I went over that. They're anywhere from what, $8 or $6 to $126. And it's based on actually your formulary. It depends on the medication that you're taking. Because when you join the Medicare Part D plan, that's why you're having a plan comparison done. So you can look at your medications, see what tier they're in, whether 1, 2, 3, 4, 5, you know, how much it's gonna cost, the plan is gonna cost you. You know, sometimes the more specialty your drugs are, the higher your premium is for your Medicare Part D plan. You know, things of that sort. There's some plans that have a zero copay for generic medications and things of that sort. So it varies based on the person's medication. That's why we normally tell people, you know, some people say, well, my friend has Silver Spring, or my friend has, you know, Cigna, and they say it's a very good plan. Should I join that plan? The first thing I say, do you take the same exact medication as your friend? And they're like, well, like, no. So, well, then it may not be the right plan for you. It's based on your medication.
So is there an advantage for the grandfather plan here?
I'm sorry.
The grandfather's plan here, do they have an advantage over the other ones? The shaded ones.
Well, no, there's only one, the F plan was paying the deductible. I can't even remember, to tell you the honest to God truth. But there are plans that are no longer offered, to new Medicare beneficiaries. But, you know, the F plan used to be the Cadillac of plans because it paid your deductible, your Medicare Part B deductible in addition to everything else. And, you know, people with an A or, an F or like a G plan, you know, the G plan does not pay the, I don't think it pays, let me see. It doesn't pay the deductible. Right, it doesn't pay the Part B deductible. But, I mean, the deductible is only $226 a year. So you end up saving money on a G plan versus an F plan.
So the FI deductible, the same thing applies, they all the same. It doesn't matter what the premium.
That's correct. You're welcome. All right. Oops. Am I doing this? I'm doing this. Okay. All right. Medicare Advantage Plan open enrollment. Medicare Advantage Plan open enrollment is from January 1st to March 31st of every year. You can use it only if you're already enrolled in a Medicare Advantage plan. You can switch to another Medicare Advantage plan. You can go back to original Medicare and get a Part D plan and a supplemental plan if you want. So you have, all different options from January to March. Because some people are in a Medicare Advantage plan, and then they say, well, I'm going to stay with the Medicare Advantage plan. I don't feel like going through all the research. And then they find out in January they never looked at their ANOC, their annual notice of change, and find out there may be some changes that they don't agree with. And then they say, well, I think I want to change. Or, they might see something that they want to change plans and they change their mind. So a person can still change from a Medicare Advantage plan to original Medicare and get a supplemental plan in Part D, or go to another Medicare Advantage plan if they want. But you only have one change. Once you make that change, you're stuck with it. Okay? Oh, this is you? Okay. Special enrollment periods for people with the low-income subsidy, also known as the extra help. People that are on the Medicare Savings Program, people that are on Medicaid, through the, and get LIS through the Social Security Administration, can make changes throughout the year. January through March, April through June, and July through September, they can make changes and go from one plan to another. They can go to a Medicare Advantage plan, or they can go back to original Medicare, and the changes become effective the first day of the following month. They cannot use a special enrollment period during October through December, because everything will go into effect on January 1st. So they need to wait, through the open enrollment period. Other special enrollment periods, you can change plans if you move out of the plan service area. So let's say you move to Florida, you can we have the SHIP program, which is the state health insurance program, is a federal program. So just like we're choices, we're the SHIP for Connecticut, there's a SHIP for Florida. So you can reach out to the Agency on Aging in Florida and say, I need one-on-one counseling for my Medicare needs. And you would have to change plans if you move out of the service area. If there's a life-changing event, you're newly granted LIS. If you have loss of creditable coverage, you enter or live in an institution. If you want to go to a 5-star plan, make a slide just for it. Who put that in there? I don't know, wasn't me. There's actually no 5-star plans in Connecticut anyway. Other exceptional circumstances defined by the Center for Medicare and Medicaid Services. So sometimes a person is granted a special enrollment period. Let's say you were marketed by a representative of a Medicare Advantage plan, and they, told you the plan was the best thing since sliced bread. They told you were going to get this and that and the other, and you find out that information is not true. They tell you all your doctors are covered under that plan, and then you go to call your dermatologist, and they say, no, we decided we weren't going to go with that company again. Things of that sort. You may be able to contact Medicare and say, look, I was given erroneous information, and I enrolled in this Medicare Advantage plan under the assumption that these things were, I had, these advantages, and I don't. So I want to be made whole and go back to original Medicare. And that's an example of an exceptional circumstance defined by the Center for Medicare and Medicaid Services. Okay. All right.
Making Medicare affordable. Medicare Savings Program, known as MSP, are available to Connecticut residents who have limited income. They pay your Medicare Part B premium, in some cases pays your Medicare Part A and B cost shares. Gross monthly income is used to determine eligibility, as long as you have no assets. If you're single, the amount is $2,786. For a couple is $3,754, effective 3/1/22. Automatically qualified for LIS upon approval of MSP.
It's
Can I
not,
say something?
it's not
Right. She's our newest member of the
Yeah.
team, and this is her first presentation. So yes, there's no asset test with the Medicare Savings Program. So you can have assets, you can have $200,000 in the bank and still qualify for the Medicare Savings Program, so it does not count assets.
Low-income subsidy programs, ILS, reduces the cost of covered Part D prescriptions to no more than $10.35, $4.15. Pays a Medicare Part D deductible, also pays up to $36.27 towards your Part D premium. Low-income subsidy copays. MSP only, generic, $4.15 per drug copay. Name brand, $10.35 per drug copay. Husky C, generic, $1.45. Name brands are $4.30. Husky C, receiving home and community-based services or institutionalized, all covered drugs are zero copay. Now, I'm going to turn it to Lisa.
Every time I think I'm gonna get comfortable for a minute, I gotta jump back up. All right, so now we're gonna go into Senior Medicare Patrol, and this is preventing Medicare fraud. And, you know, as a Medicare beneficiary throughout your life as a Medicare beneficiary, you will more than likely face some type of fraud or someone trying to fraud you. Okay, I am the coordinator for the Senior Medicare Patrol Program for Southwestern Connecticut. And what we do is we empower and assist Medicare beneficiaries and their families and caregivers to help prevent, detect, and report Medicare fraud, errors, and abuse. And we do that through outreach, counseling, and education. This is a separate whole presentation on Medicare fraud because there's more and more fraud going on throughout the United States. I mean, and it's not fraud that is, you know, $10 here, $20 there. We're getting reports $253 million being stolen from, you know, Medicare. So we're trying to, you know, catch the bandits and get them in jail. Like my grandmother said, anyone that will steal from the elderly, they need to be underneath the jail. So, you know, we like to try to catch some of these people that are scamming Medicare beneficiaries. And I just want to say, I mean, I didn't know until I started working remotely how many phone calls Medicare beneficiaries get. I mean, they call me, and I'm not on Medicare yet, and they call and say, well, someone in that house has Medicare. And I'm like, well, how do you know that? You know what I mean? I start, you know, questioning them. One time a man called me and said that he was calling from the Social Security Administration. My Social Security was being frozen, that, you know, they were doing an investigation. I wouldn't get my Social Security monthly. They were going to discontinue my Medicare. And I'm saying to myself, if this was an 85-year-old woman living alone that didn't watch, you know, didn't go out to senior centers and didn't know anything about fraud, that would scare a person really. It would really scare them, you know what I mean? So I asked him, I said, well, let me speak to your supervisor. And I threw him off. He was like, what did you say? I said, let me speak to your supervisor. And he said, are you going to report me? I said, yes, I'm going to report you. Let me speak to your supervisor. He said, thank you very much. Goodbye, and hung up the phone. You know, so, you know, we encourage people not to even answer the phone if you don't know. And with the spoofing that they have, they can put anything on the caller ID. They can say Medicare Benefit Center, Social Security Administration, and things of that sort. And, you know, Medicare is not going to call you. There's 62 million people on Medicare. Medicare is not going to call you. The Social Security Administration is not going to call you unless you schedule an appointment with the Social Security Administration for Medicare assistance or something like that. Then Social Security will call you, but they will give you an appointment time. Medicare fraud. What is Medicare fraud? Medicare fraud is intentionally billing Medicare for services that were not received or billing for a service at a higher rate than is actually justified. It happens all the time. And that's why we encourage people to read their Medicare summary notice to look for errors, and we'll talk about that. I'm almost done. Medicare abuse is providers supplying services or products that are not medically necessary or do not meet professional standards. That happens when your information is bought or received, and you get a piece of durable medical equipment. The latest scam that's going on now is that people are getting a whole box of durable medical equipment. So you're getting a knee brace, an ankle brace, a back brace, a hand brace, a neck brace, all in one box. You didn't initiate it. You didn't speak to anybody. You don't know how they got your information, but it's sent to your home. And it has a return address. When you open it up, you're like, I didn't order this. What the heck is this? I'm going to take this back to the post office, and I'm going to return it. Well, you take it to the post office, you pay the postage to have it sent back. 2 or 3 weeks later, guess what? That box is back on your deck, back on your porch, because the address that's on the box is not the original address that it actually came from. But if you received it, then they can bill your Medicare. So that's when you need to be looking at your Medicare summary notice. You need to be calling Medicare saying, look, I got this box of durable medical equipment, and let them make you whole. If they cannot do what they call a CTM, which is a complaint tracking module through the Center for Medicare and Medicaid Services, you can call us and we can have you made whole by reporting that to the Center for Medicare and Medicaid Services. That information also goes to the Office of the Attorney General. To try to catch these people that are doing it. But that's one of the more common ones that's happening right now in Connecticut. Also the calls saying that, and they catch you right at the exact, a woman told me, catch you right at the exact time. Like, let's say you come in the house and you just went to a grocery store and you have 5 bags in your hand. You know what I mean? You're getting older, you haven't exercised, and your leg is hurting, your back is hurting from carrying the groceries, and you just get them on the counter and the phone rings. You answer the phone, and do you have back pain? Do you have leg pain? And you just carry the groceries in the house. You're like, I got pains everywhere. What are you calling about? And then they say you can have a free back brace or a free ankle brace or a free knee brace, depending on where you say you have pain. And then they ask for your information, and sometimes you get the actual brace or what have you, and the brace is useless. You get it and you can't even use it. It's substandard. It doesn't meet professional standards. So then you could try to call the company to send it back, and then you go through a lot of red tape trying to send it back, but you never actually get it sent back, and then people decide, well, I'm just going to throw it away. So if you throw it away, your Medicare is still going to be charged for it. And then let's say the doctor, you go to an actual, your PCP, or you go to a specialist and say, well, we want to order you a brace. And you go to a reputable durable medical equipment company to go get that same piece of durable medical equipment. And guess what they're going to say? You have to pay full price for that because you already got one according to Medicare. So that's why it's important to, look at your Medicare summary notice, if you get things like that, to resolve it, so that it's not charged to your Medicare. So if you need that equipment or something in the future, you will not have to pay full price for it. I had one person that had on their Medicare summary notice that they received a wheelchair. They never received a wheelchair. Doctor never ordered a wheelchair, but it was on their Medicare summary notice. So we had to make them whole. So if in fact they needed a wheelchair in the future, they would be able to get one. And some durable medical equipment you can only get every 5 years. So if nothing is done about it, you're stuck with that piece of, substandard durable medical equipment and then have to pay full price. Okay, examples of fraud and abuse: billing for services, supplies, or equipment that weren't provided. Billing for excessive medical supplies. This often happens with diabetic supplies. Obtaining or giving a Medicare number for free services. That happens a lot in Florida. They tell the person that if you give me your Medicare number, every claim I do under your name, I'll give you $50 cash in order to use their Medicare number. Improper coding to obtain a higher payment. That's why it's important too, especially with x-rays, excessive x-rays and lab tests. You know, you might look at your Medicare summary notice and you had a simple chest x-ray and it said that you had a CAT scan or an MRI, which is, you know, much higher than a standard x-ray.
I have a question. So what do we do about it?
You contact Medicare and let them know that you did not receive that service, benefit or service. And you contact the provider that's listed that said that they gave you the service. And you tell them that you did not have that service and they need to back it out so that they need to credit your, take it out as a billing under your Medicare.
They say, yes, we did it. So if it's
Then you
fine,
call us and then we take it from there. Mm-hmm. Okay, claims for services that are not medically necessary. This was happening with on genetic testing. There was a company that was going out throughout Southwestern Connecticut trying to go to senior housing complexes and things of that sort, trying to get people to sign up for genetic testing. You know, you got 87-year-old people want to know if you had a history of cancer in your family. Well, if you're 87 years old and you don't know by now you had there was cancer in your family, you know what I mean? And, you know, at 87 years old, even if you find out, you know, there's certain things that you can't even operate on somebody for at 87 to 90 years old, but they were trying to get people to sign up for genetic testing. And that can be anywhere from $9,000 to $11,000 billed to Medicare. So that's why they were doing it. A couple in New Jersey, husband and wife, received bills because there's a little tiny, you know how the fine print, when you see the commercial, a little tiny fine print just flashes by, you never get to read it. But the little tiny print says, if in fact Medicare denies the claim, you will be responsible for the bill. So one person the wife got a $9,000 bill, the husband got an $11,000 bill for the genetic testing. Yes.
Medicare just pay the bill without me, the person that's covered, sign off on it and authorize it?
You don't sign off on it when you go to the doctors, or when you get something. You don't sign your John Hancock on everything. The bill, you go to the doctors, they take your information, they bill it through their billing department directly to Medicare. You don't review it and sign it. So there's a lot of errors that can happen, but there's also people that are doing it purposely. Doctors, home care agencies, things of that sort that are doing it and getting away with billing Medicare for things that people never really receive.
So there is no vehicle to prevent it from happening?
The way to prevent it is to look at your Medicare summary notice for services, and we're gonna do that right now. Okay, protect yourself from fraud. How do you protect yourself? Treat your Medicare number like a credit card. I can't tell you how many people call me at Choices and they say, hi, my name is thus and such. My Medicare number is D496. I'm like, woo, hello, wait a minute. I don't need your Medicare number. Are you sure you got Choices? And they're like, I think so. I'm like, yeah, please don't do that. Don't just give your Medicare number out like that. But that same actual person that would call in and they say, hi, my name is thus and such. My Visa card number is 4669. They wouldn't do that. They'd be like, I'm not giving you my credit card number. So you have to treat your Medicare card just like you would treat a credit card to protect it. Watch out for identity theft. Be aware that Medicare doesn't call or visit or sell you anything. Be cautious of free offers for free medical services. There was an ad on Facebook that was talking about the Moderna and the Pfizer vaccines. If you take this survey, you can get up to $90 in free, something free with a value up to $90. It wasn't even a valid, you were not going to get anything, you know, but they wanted to try to get your information. So they want you to click on it because you think you're going to get something free. And, you know, in our society, the F word is the most attractive to people because people, you know, automatically think free. I can get it for free. You hear free? Oh, free? I mean, I did it. I mean, I got an email saying I can get a free scoop of Baskin-Robbins ice cream in Fairfield at the Baskin-Robbins place. I was like, free? You know, I'm gonna provide 5 miles out the way to go get a free scoop of ice cream and I can go around the corner. I would have spent more in gas to get the scoop of ice cream. But because it said it was free, you know, it attracted me. So that's what people, and then they want you to get in there and buy a gallon of ice cream, you know? So that's, you know, a marketing tactic. Don't give out your Medicare number except to your doctor or other Medicare providers. And don't carry your Medicare card unless you need it. That's controversial. Some people say, you can go in, a grocery store and slip on a banana and, get rushed to the hospital and need your Medicare card. So I say it's up to the individual, but just protect them. All right, review your Medicare summary notice for services you didn't receive, double billing, or for services that weren't ordered by your doctor. Report it, call the provider, gather the information and documentation. If you don't get anywhere, you can call the SMP program. It's a free and confidential service. We're always looking for volunteers. I have volunteers throughout Southwestern Connecticut. They help do presentations. They help people with counseling. They provide administrative work. They hand out brochures and things of that sort to different places. So please, you're welcome to be a volunteer. Give me a call, and I'll be happy to have you. And if you need assistance, you can always contact SWCAA or your SM. We are the SMP for Southwestern Connecticut, and you can call the 1-800 number and just say you need to speak to somebody about Medicare fraud, and you will actually get me. I don't know why it says just call your SMP person. It said just call Lisa, Anyway, for choices, if you have questions about choices, you want one-on-one counseling, you have Lauren Hughes here. And Lauren Hughes has been a choices counselor since 1822. Don't know how long it's been, but I know it's been a long time. So you have excellent people here in Wilton that can counsel you on Medicare. But if you have questions, if you have just a quick Medicare question you want to ask, you want to call choices, you're welcome to. Most time we're going to forward you right back to Lauren, but because they're excellent here. So that's pretty much it. Does anyone have any questions? Yes, sir.
2 questions. If you're going to go to an Advantage plan, you sign up for the traditional Medicare first,
Yes, you have to have A and B to get into a Medicare Advantage plan.
and then the doctors, if you're in the traditional, have a choice whether they accept it or not.
Yes. So that's what you have to find out, if in fact your doctor accepts the Medicare Advantage plan that you just.
No, if you just have the traditional, the original Medicare,
Right.
does every doctor have to accept it?
No.
Okay.
You have to find out if the doctor accepts Medicare, if you have original Medicare. If you go into a Medicare Advantage plan, you have to make sure the doctor accepts the Medicare Advantage plan. Either one, you have to find out. Yeah. Good question. Any other questions? Yes, sir. How many questions you think you're gonna get? You go have 1, 2, 3, 4, 5 more.
You have
That's
very
it.
interesting presentation, that's why. Can you refresh my memory? You said we can switch between plans anytime. Which those plans that we don't have to wait for
The supplemental plan, the Medigap supplemental
you
plan.
can change any month,
You can change from anyone from one to another.
anytime.
Mm-hmm. And it goes into effect the first of the following. That's why you have the charts here, so you can see if you wanted to go into something different, you can do that.
Thank you.
You're welcome. I'm just kidding with you. Get down.
That's right.
Yes, ma'am.
Medicare expenses, it's different from social security checks, that's what you're saying?
Say that again?
Medicare, whatever medical expenses you have for Medicare, that would be deducted from your social security check?
For your Medicare Parts A and B, it would normally be,
That's it,
it would be taken out of your social security check. You can have for Medicare Part D, for a Medicare Advantage plan or a supplemental plan, you can choose to have it come out of your social security check. You can choose to have them bill it to you, or you can choose to have it taken out of a checking account. So you tell them how you want it to be billed.
Thank you.
You're very welcome. Anybody else? Oh, yes, ma'am.
So if you still have insurance through an employer,
Mhm.
turning 65, do you still have to register?
Well, you have the option to continue with your employer insurance. You can defer your Medicare Parts A and B until you retire.
Oh,
And then once you get ready to retire, you normally get offered COBRA. Okay, but you have, from the time you lose insurance or lose employment, whichever comes first, you have 8 months to get on Medicare Parts A and B. And then you have 63 days to get onto Medicare Part D. COBRA is not considered comprehensive coverage. So if you pass that 8-month period, and a lot of people get caught with that.
Yeah.
Because, you know, some people say, well, hey, I like my Cobra, I have more benefits than Medicare, I'm gonna stay on. I had this man in Easton, and he fought me tooth and nail. And I told him, I said, if you go on Cobra, and you go the whole 18 months, wherever that lands, you may end up without coverage until the general enrollment period for Medicare. So, of course, this was May, and I think he decided he was gonna go on Cobra, and he stayed on it 18 months, and he called me like the next year, like June, July, or something like that. And he says, well, I called Medicare, and they said I can't join until January. And now I don't have Cobra, now what do I do? I said, remember that conversation we had? Remember that conversation where you fought me tooth and nail? So it's very important that you look at that 8-month period. If you decide to go on Cobra, I mean, you can go 8 months on Cobra, but after that 8-month period, then you're subjected to the penalties. And the late enrollment penalty after 12 months, and it, you know, depending on what time of the year that it falls, it may have a negative impact on your ability to get Medicare A and B. Now, Cobra is considered creditable coverage for Medicare Part D for prescription drugs, but you still have 63 days once you lose your Cobra. Okay, so if you decide to go on Cobra for 8 months and you pass 63 days because you stopped and you went on Cobra, you will be able to get on to a Medicare Part D plan without penalty because Cobra is considered creditable coverage, but it's not considered comprehensive coverage for A and B. Once you lose that employment, lose insurance, you have 8 months, period. Okay? Period, yep. Yes, ma'am.
Is the November 10th event, is it by appointment or is it all day?
It's by appointment. You would have to call Lauren's office.
So,
And-
yeah,
oh,
hi.
here she is.
So my card is on the back table, the number's on the card. If you want to come to that event, just give a call to that number and ask to speak to Debbie, who's our administrative assistant, and she'll give you a time slot.
Thank you.
And we often tell people who are still turning 65 and employed and using their employment insurance to enroll in Medicare Part A because it's free.
You have the option to join Medicare Part
And
A
you
because
decline
it's free,
Part B.
yes.
And that way, you don't get caught, you know, in the problem of do I, don't I, will I, won't I? And then when you retire, you simply send in a form from yourself and from your work and enroll in Part B, but you're protected by having Part A.
Okay, so you say you roll, once you're in insurance 65, you roll in Part A, that's all you need to.
Correct.
You continue to work, and then when I retire, we'll repeat.
Correct.
Right.
Okay.
You can do that also. You
So-
can either not take it or take
So
it.
my card is on the back table. I'm in the office Mondays, Tuesdays, and Thursdays, and my colleague Ellen Ben is sitting in the back. And Ellen is helping with Part D enrollment, and she's very smart about all this stuff. So we have a lot of coverage, plus the event on the 10th. And, you know, you're welcome to call anytime, make an appointment. And even if you're not quite ready, you know, we can plug in your information into the Part D plan finder and give you some kind of sense about what your prescriptions will cost you. Yeah, so, you know, I'm available. This is all, it's a lot of information.
So Lauren, that's the retirement to enroll for the Part A, you mentioned the HSA.
Say again?
The HSA.
Right, thank you. Okay, if you have an HSA, you don't want to enroll in Part A.
Right.
You can no longer contribute to the HSA. And also, if you're considering retiring and you need to stop contributing to your HSA 6 months prior to when you
That's
can
right.
enroll in Medicare.
Told you she's good.
Because, but thank you for reminding me, because you'll have to, they will tax you for that 6 months if you continue to contribute. They make this very complicated now.
Always.
Yes,
If you're in a group plan,
right.
you enroll, I assume you tell the group plan, do they give the company a discount? I mean, if you're covered by both,
You're not covered by both because Part A sort of sits in the background and it does nothing for you if you're on a group plan. If you're still working and you're covered by your employer's insurance, it's what's there. It really doesn't do anything.
Okay, well, Lauren can take it from here.
So come and see us if you have any questions, and thank you so much. This
You're
was really
very
great.
welcome. You're very welcome. Thank you so much.
Thank you, Michael, for arranging it.